Now look at another factor, and this factor is very important. If I want to actually get a high quality image, all right, so if I want to get a high quality image, this factor is very important. Okay, and this is what is known as you are trying to place and also what orientate the anatomy on the image receptor and radiography. So you just have to do it, the connection between the light source, the patient's body, and what the image receptor, also to say, you could say what dictator, you know. So placement and orientation of the anatomy on the image receptor are critical for producing high quality images. Do you understand? So when you properly position everything, it will actually be very nice, and it will ensure that the anatomy of interest is now fully captured and everything is good, So principles of placement and what orientation is correct centering. So you have the central rays must be directed to the center of the anatomy. So if I want to measure the chest, it should be well placed. Do you understand? Because you don't want issues, you don't want images that are not clear, so later on now you're now forced to still be doing imaging again on something you have done. Then also alignment of anatomy with the IR. Okay, so orientation of the IR, that's just it. Just have to do it. You are trying to arrange everything with the image receptor. So image receptor must be positioned vertically, horizontally, or obliquely. This is depending on what you want to image. Orientation should match the anatomical region being imaged. So you always try to know if it is the left side or the right side you want to image before the exposure. So patient positioning, you have to position the patient very well so that you get the best result, and you have to now streamline the radiation energy directly to the part where you actually need. You have to streamline it to the part where you actually need the imaging to be done at. So projection consideration, you have to now check whether you want the anterior posterior view or the posterior anterior view, the lateral view or the oblique view. So special cases, if you want to image the extremities, place the long axis of the bone parallel to the imaging receptor. Spine, you have to align the vertebrae column with the long axis of the imaging receptor. In the skull, you have to adjust the head orientation to match the required projection. Okay, so I think this is what we got for everything that you should know about trying the importance, mainly the importance. So what you want to image should always be in line with your image receptor.